Hello, everyone. Hi, Dr. Tareen.
Having me. How are you?
Good. How are you?
Thank you.
Thank you so much for coming on board today. Um, we are so excited. We got so many questions. So I would like to just go into a little bit of detail about what you do exactly. So everyone, please welcome Dr. Tareen. Like I mentioned before, she is a board certified dermatologist. So before going into the questions that we have so many, would it be possible to just give us a brief explanation on your medical background as well?
Absolutely. So, my name is Dr. Mohiba Tareen. I'm a board certified dermatologist. I practice in Minnesota, relocated here. As dermatologists, we are specialists in skin, hair, nails, and sweat glands. And we see many patients with these issues. And we are the last stop for patients with resistant hyperhidrosis, excessive sweating. So we have options as dermatologists from topicals to orals to wonderful iontophoresis discussions for surgery. So as somebody who's suffered from hyperhidrosis myself, I'm really passionate about it. I try to bring it out for my patients. So many people are embarrassed to talk about it. So
Mhm.
I'm bring this to your forum today.
Thank you so much for all the information. And if anyone is seeking hyperhidrosis treatments, please feel free to reach out to Dr. Tareen in Minnesota area. So we did get many questions going into hyperhidrosis and iontophoresis treatment. We would like to begin with how common is hyperhidrosis in your patients?
So hyperhidrosis, if you look statistically at numbers across the board, is seen in up to 10 to 20% of people at any point in their lifetime. It's definitely more common kind of in that teen, young adult phase, but I see 80-year-olds, 100-year-olds who are still plagued by hyperhidrosis of their face, of their axillary area, of their groin. So it really can affect anybody. And the sad thing about hyperhidrosis is that most patients don't bring it up to their physician or ever treated and live with it. I mean, just coming back to my story, both of my
Mhm.
doctors, I'm a pretty educated family, and I lived with hyperhidrosis myself for so long. I used to always have yellow armpit stains. I used to put like socks and like gross things under my arm just so I wouldn't have like that like staining or that smell. And it, it's such a stigma, and I'm so happy that you're doing this forum so people know it's a medical problem. You're not embarrassed to bring up high blood pressure. You're not embarrassed to bring up diabetes. Why should you be embarrassed to bring up hyperhidrosis?
Exactly. And I think having these one-on-one with medical experts like yourself is really important to spread that awareness. And we want to make sure that everyone feels comfortable speaking about hyperhidrosis as well. And so you touched upon a little bit on the common areas or focal points that people do suffer from hyperhidrosis. What are the common complaints that you do receive from patients?
So, I mean, just starting from the top downwards, many people will have scalp hyperhidrosis where their scalp actually will just get soaked. They'll be sitting in a room, they'll start getting soaked, and they can never make a hairstyle, or they feel that they always look dirty or greasy. Same thing comes,
Hmm.
will just get flushed and get drenched. Can you imagine going on a job interview and being asked a question and then pouring sweat? I mean, that's not conducive to success. Many people will have hyperhidrosis. That the most common area, one of the most common areas, are axillary areas, the palms. It's not spoken about, but so many people have hyperhidrosis of their groin area. I mean, all the time, treatments, including Botox, other medicines for the groin area of both, and they feel so embarrassed. We had a patient today who said that she felt that she looked like she had peed upon herself, you know?
Yeah, thank you very much for sharing those stories. And I feel like, even patients that are speaking with their dermatologists or medical experts, they feel sometimes so shy and timid of speaking about those. Um, yeah, and, you know, having hyperhidrosis yourself also, you could tell automatically, like create that personal experience with the patient. We do have multiple hyperhidrosis treatments. Can you tell us about the different options that are out there for the viewers?
Absolutely, absolutely. So hyperhidrosis, very commonly, if it's just a minor form, like having a little bit of excessive sweating, palm sole, etc., we often can use topicals as dermatologists. There are
Mm-hmm.
some approved prescription treatment options. One of them being dry sol, which is a topical applied to the area. There's an over-the-counter one called Carpe, which is also an aluminum-based type of thing.
Mm-hmm.
So those are some topical ones. The problems with some of the topical ones is that unless these topicals are applied to totally dry skin, the aluminum can actually burn the skin. And that's what I experienced when I was, many, many years ago, guys, when I was 18, 20 years old, when I was applying dry sol, I would always get these perpetual rashes. And then I would have to make the decision, do I want to be rashy and itchy or do I want to be pouring sweat? Do you know what I mean?
Yeah. Yeah.
That's hard. There are some new wipes called Qbrexza, which also have a prescription topical agent in them. They're great, but like everything in life, they can sometimes have some side effects, some dilation of the eyes, some other side effects. So everything, even topical things, come with side effects.
Mm-hmm.
To orals, there are some oral medications in a class of medications known as cholinergics. These medications help block some of the excessive sweating, but they also block some the saliva, so you can dry
Mm-hmm.
mouth, block some of the lubrication of the eye, so you commonly get dry eye. Um, One of them, oxybutynin, which I sometimes do prescribe for patients with very, very excessive hyperhidrosis, can even cause bladder spasm and cause urine. So these medicines are not without side effects. Um,
Mm-hmm.
that we do, obviously, of course, I think we're going to talk about iontophoresis, particularly with Dermadry. That's a really nice option. I get calls and requests for prescriptions all the time from my patients. And because it's such a safe option, once you get it, you have the unit. It's not a perpetual thing that you have to keep spending money on it. In general, people with hyperhidrosis, if you're young, you're not making a lot of money. So that's why Dermatry is such an option for my patients. Moving,
Mm-hmm.
there's Botox and Dysport. These are different toxins that can be injected under the skin and helps disrupt the it helps disrupt the synapse that connects the muscles to the nerve, so there's less of that hyperhidrosis. And
Mm-hmm.
then end spectrum, there is sympathectomy, where some of the nerves are disconnected from the sweat gland. That's really, really, really the last option. I almost never recommend it. I've only recommended it a few times in my career because that can sometimes lead to something called compensatory hyperhidrosis, where the area where you've had the nerves removed can relax, but then you can get hyperhidrosis other places.
Mm-hmm. And actually, speaking about that, for the surgery, there's a question that came in. They want to know what are the risk factors when it comes to the ETS surgery?
Oh my God. So the most common risk factor is that what's called compensatory hyperhidrosis, where then because your sweat has to be expressed somewhere, you'll get excessive sweating in really random places. So
Mm-hmm.
one who had ETS surgery before she saw me now has sweat, really, really terrible sweat on her lower back and on her buttock area. So she,
Mm-hmm.
I mean, why did I ever do the surgery? Because I'm kind of like in the same place, but in a worse area.
Yeah.
So that's the main side effect. Sometimes it can cut nerves. Of course, it's done in anesthesia, so the risks of anesthesia. So I highly recommend iontophoresis, Dermadry, and other kind of more safe options before we even discuss.
That's amazing to hear. And there's questions that are so many questions that are coming in actually. Thank you guys so much for sharing these questions. They want to know what are your thoughts when it comes to iontophoresis treatment? And you did mention that you do prescribe it often. But what are the feedbacks that you've been getting from patients? They just kind of want to know in a general scope.
So iontophoresis is fantastic because, like, so you're not hyperhidrosis other places. You're using just good, safe water and an electric current to help block the sweat glands from overexpressing cells. It can be done. The best thing I hear from my patients is that it can be done from the comfort of your home. Nobody needs to see you. You have the device. It's safe. You're not doing anything long term. Like a lot of women worry that they'll be doing long term their fertility or, their eggs and things like that. This is just a local thing that's going to help with the.
Yeah, and I think, there's a lot of patients and viewers out there that are asking these questions for themselves because they are interested in the treatment as well. So I think they want to understand a little bit more on how does iontophoresis work. There is you did touch upon on the treatment areas, but they kind of just want to know in a few words on how the process works.
So in general, you guys are the experts at it. As doctors, we prescribe it, but I'll let some of your scientists kind of, go through more of the science with diagrams. But our understanding as specialists and dermatologists is that the ionic current helps block the conduction of the nerves to the sweat glands in a local fashion, so there's not a systemic disruption. And so the patients get improvement in those focal areas, so they're not going to get overall dryness or anything. It's really just localized. So it's really great for those people who have localized hyperhidrosis.
And that's really well said. And that's exactly on the lines of on how we do work when it comes to iontophoresis treatment. We do it on the hands, feet, and underarms. And like you said, we're basically just deviating that messaging from the sweat glands. And they will be able to get their dryness that they're looking for. There have been so many success stories along those lines. They're finally able to wear cream on their hands or moisturizing cream for the first time. So we hear so many amazing stories on that end.
That's what I hear. People are so happy. They come in after iontophoresis and they immediately put their hand out for me. And it's
I love to hear that, and I love to hear the comments back from the patients to the medical experts. It makes us really happy. There's a question that came in. They want to know, can hyperhidrosis diminish with age?
Absolutely. So we sometimes do see that at the initiation of puberty, as the adrenal gland will let down and give more testosterone and hormones. Many people will experience hyperhidrosis. Sometimes that hyperhidrosis, as we get into kind of our late 20s, early 30s, it will start to temper down as those hormones start to normalize. But again, we often will see hyperhidrosis persisting and sometimes worsening for women before and during menopause. And, for men, as they age, they may get excessive hyperhidrosis just kind of from other like blood pressure medicines, et cetera, can exacerbate some of these conditions. So it may diminish, particularly if you have acne associated with hyperhidrosis, acne and kind of extra oiliness. As you regulate, you may see your hyperhidrosis diminishing, but it's not always. And I see patients across all age groups who really are perturbed by their hyperhidrosis.
Mm-hmm. Thank you very much for touching upon those details. They also want to know, what causes hyperhidrosis? We know there are the two spectrum levels. Can you kind of just explain us a little bit more on what causes hyperhidrosis?
Absolutely. So as dermatologists, we categorize hyperhidrosis into primary versus secondary. Primary is idiopathic, meaning we do not have the cause for it. And that is the vast majority of hyperhidrosis. That it's unfortunately, like in my case, nobody had hyperhidrosis in my family. Fortunately, I was, Secondary hyperhidrosis is attributed to a medical factor. Sometimes it's thyroid disease, sometimes it's anxiety, sometimes it's a tumor. So rarely we see, kind of brain tumors or tumors that hypothalamus pituitary axis that can activate those sweat receptors. So that's why it's really important if you have uncontrolled hyperhidrosis to see your physician. Although it's rare, there may be an underlying medical cause. You should have some blood work, potentially that for really bad hyperhidrosis, even some imaging.
That's a great tip. I don't think many people really go through that whole blood work side of things to really kind of figure out exactly what is causing their hyperhidrosis.
And so thyroid issues. So many times there's both a primary cause where you don't, but then there's a little bit of a secondary cause too. And if you can mitigate that in some way, it gives the relief. It also can help with other medical issues.
Exactly. And now there's a question that is coming in that is touching a little bit more on iontophoresis. they want to know what really works for them when it comes to iontophoresis treatments. Is there some type of structure that you work with to figure out on what patient is suitable for iontophoresis?
So iontophoresis is such a safe, wonderful treatment. It's almost suitable for anybody who has primary focal hyperhidrosis. If you have generalized hyperhidrosis, kind of hyperhidrosis everywhere, iontophoresis is probably not the treatment for you. But if you have hand, foot, or axillary hyperhidrosis, anybody is a candidate because there is no systemic side effect other than just getting the prescription and the cost that is actually with your product not that high for something that's that high quality. Most people are. So, and some people will see a result with Dermadry. I think you guys can see even up to. So it's an exciting thing.
Yes, it's very exciting. And, there was people that were asking us questions about, when it came to their treatment schedule or when it came to the results. And when it specifies, for example, like the results, people could begin to see results within the first 2 weeks. Some begin within 6 weeks, depending on how frequent they're using the treatment, and so on and so forth. So it's really exciting to see those as well.
Absolutely. I mean, and for such a low risk thing, right? Like you're not hurting yourself, you're not putting anything in your body, you're helping reset those nerves. So why not?
hmm There's a question that came in. Can people with eczema use iontophoresis treatment?
Excellent question. So it depends. Eczema is a condition where the skin gets red off the skin because genetically the skin cannot hold onto moisture because the skin cells are lacking some special proteins that hold on. Iontophoresis and eczema can be compatible. Occasionally, that iontophoresis can exacerbate or dry out that eczema process. But what I recommend to my patients with both hyperhidrosis and eczema is use your iontophoresis. You get some patches of eczema. Just make sure you put a little bit of either Vaseline, like a petrolatum, or if you have a prescription, you can just apply that. So they can be compatible. Just be really good. One little tip that we recommend as dermatologists, they're called wet wraps. So if you're doing your iontophoresis, you're getting really dry, what you can do is before bed at nighttime, just put some Vaseline on in like some gloves and you'll wake up and your skin will be so much softer.
Those are amazing tips. We totally understand when it comes to the Vaseline. That's actually a great tip. We had a lot of patients that were actually asking about that. I saw popping up some questions about that also. So thank you very much. Moving forward now to the next question. Can you explain a little bit more about the maintenance phase when it comes to iontophoresis treatments?
So the nice thing about iontophoresis is it does work for almost every challenge that the regimens will differ for everybody. What I say, go down from every other day to once a week, see how you're doing. You don't want to change variables. Just start by going down once and see what that does. Because some of my patients are controlled at once every week. Some of my patients are controlled every other week. So it's a person. Also to variety.
Those are all really, really good points. I don't. Oh, okay, perfect. I wasn't sure if I went frozen for a second. Thank you very much for those tips, and everyone's sending you love. They were while you were explaining, so I think they really resonate a lot with that. Um, they also want to know, does iontophoresis help with odors as well?
Yes, 100%. The odor will come both from not just from the sweat, but it comes from the bacteria that then live in the hair follicles that contribute to that odor. So getting rid of the sweat will help eliminate some of the expression and living of the bacteria in the skin. Will you sometimes use a little bit of an antibacterial wash in addition to your iontophoresis? Yes, but just by getting rid of the sweat itself, you will have less odor. And as somebody who suffers from hyperhidrosis, you will feel less smelly just by being less. You may not be smelly, but you feel smelly when you have hyperhidrosis.
I know. And we are always in conversation with medical experts or advocates for hyperhidrosis or patients that do suffer from hyperhidrosis. And that is always a comment that we get. And they're so excited when they use iontophoresis treatment like Dermadry. They're like, oh, we actually smell amazing now. You know, some of them, they're like, we just use deodorant just to cover up a little bit in case, but because they like the smell. But it helped them a lot with the odor as well, which is really exciting. There's another question that came in now. We're switching gears a little bit. It's going into women that are pregnant and women that are nursing. Um, for a mother that is using iontophoresis treatment, can they use it while they're pregnant and can they use it while they're nursing?
Tap water iontophoresis is considered safe while you're pregnant. This is one of the few therapies for hyperhidrosis that we can across the board recommend as dermatologists. Again, it's just tap water and a little bit of safely applied electric current. Many of
Hmm.
them are not considered safe, and definitely Botox support are not considered safe while nursing. So it is one of the few safe options that you're not putting chemical into you. So you're consuming water, and 99% of your body is water, so you'll be fine.
What's really important to note is it is safe for mothers out there as well. However, we really recommend to make sure that it is mostly for nursing mothers. You know, we did touch upon a little bit when it comes to studies for pregnant moms. Really want to make sure that there's not enough data yet for that. So for mothers that are nursing out there, you are clear to use the treatment. However, if you are pregnant, it's really important to obviously consult a medical expert and go through all the options as well with them, just to be sure and safe.
Always agree. Whatever you are doing, just consult with your OBGYN because they know your specific.
Yes. And there is another question now. Iontophoresis treatment, is used for multiple age groups. There's somebody that wants to know, is it safe for their child?
So I recommend 12 and 15. Is that correct? Is that the official recommendation?
So in the United States, our official recommendation is 21 and over. However, depending if the medical expert is working with the child and they go through all of their medical conditions and so on and so forth, and the medical expert is agrees that iontophoresis is treatment for them, then that would work perfectly. But we always make sure that it's important that the child and the medical expert work together just to be sure that the treatment is right for them.
So I concur. Again, whatever your FDA approval is, as doctors, many medicines are not FDA approved for either specific best medical best going through the risk factors. I have patients who are 16 years old who I very comfortably.
Yes, exactly. And in as well for medical experts in Canada, it does follow the same rules as well. However, there could also be 13 and over, but like I said, it's always very important for the physician to work together with the parent and child. There is another question coming in now regarding food or lifestyle. So they want to know what foods or lifestyle changes um, can worsen or make a hyperhidrosis a little bit better for those who do suffer from hyperhidrosis.
So what I see in my practice for foods, any food that has a high glycemic index are starchy, bready, very high sugar, things that release insulin right into your blood, right, and flare your hyperhidrosis because it's turning on those both those fat and sweat receptors. So you
Mhm.
really eat as much of a cooling diet as possible. Reduce inflammation, probiotics, fish oils, nuts, kind of more. We always like to say for people with hyperhidrosis or inflammatory disorders, what's called the Mediterranean diet, which is high legumes, high lentils, high vegetables, olive oil. Those things bring down inflammation, not
Mhm.
things Western diet that increases inflammation. In terms of activities, I always recommend as part of either topicals or iontophoresis or Botox. I recommend calming activities, things that like 5 deep breaths have been shown to calm down what's called your vagus nerve, which is a nerve in your neck that controls all your metabolism. It is almost impossible to have a racing heart if you've taken 5 really deep oxygenated breaths, and that can calm down your hyperhidrosis. Yoga is a really great one. Things that really just help you get back to your core self.
Hmm. And those are actually great tips also for those that do get anxieties, that come with hyperhidrosis as well. So I think those are great tips for those out there that have hyperhidrosis, but also get those anxieties and those anxiousness when they have, the sweat marks or so on and so forth. Um, there is another question that is coming in with that. When it comes to someone that is suffering from anxieties due to hyperhidrosis, what other tips and tricks do you have for them?
I really say go see your medical expert. So many of our patients with hyperhidrosis have been trying to treat themselves at home for years and years, and they think, hey, I can, do diet, I can do yoga, I can do that, but still they're flaring. So there are medications we need. There is ibuprofen we can prescribe. It is make an appointment. It can change your life, and then as you get better, your hyperhidrosis will, cyclically keep getting better, and you'll just feel better about yourself. So all, becomes one self-prepared cycle. So go see your medical expert.
Yes, that's exactly it. And we also want to know, you touch upon great points when it comes to the medical experts. I know we're getting so many questions that are coming in, and we want to thank you all, but we do want to let everyone know that we have about 5 minutes or so left wrap up. But before we do move forward, we want to know what are your thoughts and other questions that you may have for the community when it comes to hyperhidrosis or when it comes to even iontophoresis treatments. So they want to know what are your thoughts on that as well.
So I think one nice thing, and definitely you and your colleagues speak on this, I want to speak about how Dermatry is really unique, how it's so easy to use, how it uses tap water, how it's so affordable, and you get it sent right to you. So that's one thing I'd love if you could touch on, because I really think it's a novel iontophoresis device compared to the ones that you just get, and it's a big tub and it's all messy and everything. So, I mean, I have it right here, and you can see it's so portable. If you're going on vacation, you can even take it with you.
I know, and even thank you very much for sharing that. And I think the thoughts from everyone and the questions that they were coming in when it comes to iontophoresis treatment, they people are intrigued of learning about this new treatment. Well, even though it's been around for a while, it's a new treatment that is still out there, still that taboo topic, and I think us creating this conversation today is really opening the doors to not just iontophoresis treatment, but even hyperhidrosis in general, and speaking about it and going forward with it.
Absolutely. I mean, it's an easy step to take. You can be the healthiest person. Without question. Healthy lifestyle and diet help or do that this way. Of course, you want to be at your goal weight. You want to help with your anxiety. You want to get all that under control. But even then, it is primarily a medical disorder. There should be no stigma with addressing it. Go see your doctor.
Exactly. And I think even like I said earlier, just us creating this conversation today, I think is really important, especially now with whatever is going on right now in the world. I think it's important to keep that community base and going forward and speaking about our thoughts and our feelings and how we feel about not even just hyperhidrosis, but even example the anxieties that touch upon it, the lifestyle. And I think we brought up many great points today about that.
Right. My
But
main audience is, unlike me, don't wear maxi pads under your arm. Get a Dermadry device. Dermatologist, because I wish I would have asked to see my dermatologist when I was suffering from hyperhidrosis.
And you know, you're not the first person to say that. We had somebody else that mentioned that previously, and I still can't believe this to this day. There's even stylists or in any industry that were they were using those to cover up their hyperhidrosis. And now there was somebody that we were working with as a stylist, and she said the same thing. She's like, "Thank you so much," like, instead of putting the maxi pads. Um, Thank you again, Dr. Tareen, for coming on board today and answering the questions of the community. So like I said, for anyone that is in her area, please reach out to her. Please don't be afraid to, have answer. She was free to answer any questions that you may have. Not even just about hyperhidrosis, but even when it comes to other um, treatments that you might need. So thank you again for coming on board today, and have a great one.
Thank you. You too. Have a great afternoon, everyone. Thank you.
Bye.